Good morning, everyone. So it is Tuesday the 16th. I hope everyone is well. If everyone could put their microphones on mute and use the chat bar for the moment, I'd be very grateful. And if you've got any questions, just pop them through to the chat bar and let me know if you want to talk about anything or ask any questions at the end. So I've got quite a few updates for you this morning. Just to let you know, this webinar is being recorded as usual. So the real key thing this morning I'm going to talk about is children and shielding. So there's some new guidance that has talked about who should be still shielding, and the Royal Colleges have released some guidance and put children into Group A and Group B. And I think this is really important for primary care to be aware of. So Group A is lists of conditions that still require children to continue shielding, and they will be contacted as well to continue that. And then Group B are those conditions that require discussion between the clinician and the child and their family, and it's a case by case. So you need to decide whether that child needs to be shielding. And so it's the obvious things in Group A. So it's the children and young people who are in having immunodeficiencies or remain on immunosuppressive medication, or those children with the risk of severe infections due to immunodeficiency or induced by the drugs that they're taking as part of therapy. So, for example, post-transplant immunosuppression, vasculitis. So those children on cyclophosphamide or high-dose steroids particularly, and then those that are clinically vulnerable after transplant as well. And there's also in the list those with acute leukemia, so ALL form, the non-Hodgkin's lymphoma, and those who have AML and are receiving chemotherapy. So obviously the hospital will be looking after those children and will be informing them. The other ones that you need to be aware of is anyone with sort of a respiratory or neurological condition that makes them unable to cough and clear their airway secretions due to the severity of their disease. And so those are likely to have sort of severe neurological problems. So think people with cerebral palsy, for example, or neuromuscular disabilities, or anyone with a severe motor impairment might be in that group. And then the final bits are those who are life dependent on long-term ventilation, so CPAP or BiPAP certainly. And again, we're going to have very few of those in our practices. We're really not going to have many of those. So it's going to be a few handful of those. So just to be aware of those children, but they will be written to from the hospitals. The next thing I wanted to talk to you about this morning was about face covering. So on Friday's webinar, I talked to you about Public Health England guidance, and they released it on Sunday night. And what they said is that Public Health said that primary care should follow the same advice as they've always done previously, and that is if you're working in reception or a member of staff is going into a communal area, or of course you're working with somebody who might be COVID, or generally we're not doing that in primary care, or you're unable to maintain a 2-meter distance, then we should be wearing a surgical fluid repellent mask. Now, what does that mean? So in my practice, for example, if I was to go into the coffee area and make a coffee and someone else came into the area, it's quite hard to maintain a 2-meter distance, although we try it. Often we're sort of in that 1-meter zone, aren't we, for a few moments, without realizing we kind of sort of starting to relax those things. Or if I pop into reception to say hello to the reception team, it's quite hard. 2 meters is quite a distance. So what should we be doing in those areas? And I think it's really for individual practice to decide, depending on their premises, what they think is right, the number of staff they have in the building. But certainly there's no harm in considering whether you wanted to offer staff a face covering. Now, face covering is different to a face mask. So a face covering is something that you put on your mouth and nose, and it's not a surgical fluid repellent, but it protects others that you're around if you were to cough or sneeze or have any respiratory droplets. And you can get them for a couple of pounds and they're washable. So I think that's something that practice might consider, albeit there's no official guidance. I think we've got to, as independent contractors, make decisions that are the right thing for us, I think. So I'll pause there for that part. The next thing I wanted to update you on is a really new thing that's come out only today, really, and that's, again, I mentioned to you last week a support about type 2 diabetics, but what's really great this week is there's a new support for type 1 diabetic patients, and there's 2 things that have been released by NHS England Improvement. and that is structured educational but digital. And there's two ones. There's one called My Type 1 Diabetes, and that's for the adult service. So this is something that we can equally promote to patients with type 1 diabetes, and it will help us fulfill our QOF points, to say that we've signposted to a structured educational resource that we have to do, and patients can self-refer to it. They don't have to be referred by us again. So all we would have to do is signpost the patient and code that as QOF. Now, whether we do that sort of when we're seeing or speaking to type 1 diabetic patients, or whether we decide as practices we want to contact them by text, email, or letter. Again, we're not going to have huge numbers of type 1 diabetics, but that would now count from NHS England as your QOF point for offering structured education. And the website for that is www.mytype1diabetes.nhs.uk, and it's number one, so it's mytype1diabetes.nhs.uk. And when patients go on to the website and they self-register, they'll be able to access the diabetic patient helpline. They'll receive text messages if they sign up from the service, and they will also be able to get lots of other resources available to help them manage their diabetes. And the same thing, NHS England has also commissioned a very similar service for children and young people, and it's got a slightly different name. It's called Digibet. So I'll spell that is DIGIBETE, and the website is www.digibete.org. And with this one, they've actually released an app for young people to download. And again, we can signpost them either by text, email, or letter. And again, that will count as our QOF points for referring those children, young children with type 1 diabetes. And thanks to Charlotte for putting the websites on the chat. The next thing I wanted to update you this morning was about Consultant Connect, and I mentioned to you last week that the Barnet cardiologists are coming on board, and they started yesterday, which is fantastic. So we've got 4 consultants from Barnet and the Royal Free have joined the rotation. So if you picked up the app and called a cardiologist between 9 and 5, Monday to Friday, you'll be speaking to a local cardiologist from our network. Outside of those times when the Consultant Connect is open, you'll be put through to the National Consultants Forum. It will tell you when you dial, it will say you're being connected to the Royal Free or Barnet consultants, or it will say you're being connected to the National Consultant Database. So you'll know where the consultant is when you speak to them, and that's really great as well from there. We've had huge numbers of GPs using the service. I think that's really fantastic. So thank you and well done for using that. The final update I wanted to provide you was about the restart of planned care services across North Central London. So at NCL, there's been a lot of work involved with primary and secondary care to get things back into gear really and start seeing people in outpatients, and whether that's digital or face-to-face. And what hospitals have been doing is really planning for that over the last few months and weeks. And also getting theatres and wards deep cleaned regularly with national guidance and getting the right level of staffing and equipment. So what the Royal Free are planning to do, and all of our NCL Trust, is prioritising services based on the greatest need and the most urgent patient requirements. And they'll be doing that by working across NCL and working together. And they're going to be producing those lists of patients within the next 4 weeks and seeing everything urgent up until then. And then they've got a plan to restart routine care sort of in 4 to 6 weeks time for those people that have been backlogged and those that we've been referring over the last few months to start seeing those patients. And just a bit like us, they are talking about digital first. So just like we are seeing people digitally, they'll be doing the same thing. So they'll be offering virtual consultations. And if you have a look on the Royal Free website, they've got a video for staff and patients to see, similar to AccuRx, but they've got a different software, which is very, very similar. But it's just the one that they've chosen across the Royal Free Trust Hotel, and you can have a look at how that will be for patients. It's quite a good software that they're using as well. So I'm going to pause there really, and that's all the updates from this morning. If there's any questions, if you could pop them in the chat bar or let me know now. And I've got a question here about, can we do routine referrals? So you can absolutely do routine referrals to acute hospitals, so cardiology, respiratory, but our sort of routine community services like physio, podiatry and MSK are still suspended and hoping to restart in July. and we'll keep you updated about that. And absolutely, you can still refer to InHealth for things like ultrasounds, 24-hour blood pressures, 24-hour ECGs, and things like that, and echoes as well. And so there's a couple of InHealth sites. And you can also continue to refer for phlebotomy to Finchley Memorial and Royal Free and Chase Farm, and the paediatric bloods are continuing to be done at Edgware. And you can patients can sort of phone up and book online for that. And there is a screening process available for patients when they are booked in to have a blood test, so making sure they don't have coronavirus symptoms. Has anyone got any other questions? Pop them in the chat bar, or feel free to ask me now. And routine X-rays. So X-rays certainly are being done at Barnet and the Royal Free. So you can just follow the email process that we've sent out previously, and then people can be contacted for the X-rays. Obviously, if it's an urgent X-ray, so you need something done urgent, you can send them with the form, making sure you've marked it and signed it as urgent. If the patient has a minor injury, and you're worried about a fracture, for example, the walk-in centre is still open at Finchley Memorial Centre for X-rays, but not currently at Edgware. Just to remind you, that is closed until further notice at the moment, and being used as the Advanced Assessment Clinic, or known as the Hot Hub at the moment. Are there any other questions from anybody? Okay, if not, I'll see you all on Friday, and thanks for joining me, and have a great rest of the week. The sun is shining. Thanks very much, everyone.